Well, I was the executive officer of the health program within the Community Action Program of the Office of Economic Opportunity. It had started earlier, as you know, on a demonstration basis, but the real expansion took place in the late 60s. Well, we were a pretty exciting group. I mean, OEO is an exciting place, actually, and we had a pretty strong team. I mean, it's the nature of the beast that you have a lot of healthcare reformers. I mean, that's how it got staffed, is there were enough people within the medical profession who were interested in this type of activity. And then there was enough community support when they found that it was being responsive to their interest and to their needs. So you get that dynamic of community support, of healthcare reformers and community activists. And we had that on our staff too, I guess I should mention that. The nature of the health program staff was really a coalition of health professional reformers and community activists. So we reflected in the central office what was going on out in the community. And so we had a number of young healthcare physicians who were interested in changing the world, and then a lot of young, dynamic community activists. You know, the term social entrepreneur has become popular. You familiar with that? The social entrepreneur? Well, these are healthcare reformer entrepreneurs. And there's a cadre of healthcare. There's a large cadre nowadays, maybe a little smaller back in the 60s. There's a large cadre of healthcare reformers. And they have attracted a lot of self-selection going on. But that's what made it go. I mean, they were interested in this new opportunity. There was Liz Shaw, whom you know about. And then there was Dr. Julie Richmond, who was from Harvard Medical School, who was the co-founder of Head Start, but he was also involved in the health program activities. And then there was Dr. Joseph English, who was a psychiatrist who had been working with Shriver in the Peace Corps, and who knew the Kennedy family pretty well. And then there was Dr. John Frankel, who was a dentist who was very much committed to community action. So those four people were a pretty strong team. But I like to emphasize that the key guy in the activity was Sergeant Shriver. If it wasn't for Shriver, it never would have happened in OEO, because there were a lot of people in OEO who felt that this was all very interesting, but wasn't a lot to do with community action. And within the community action program, I would say that was the predominant feeling outside the health program. But none of them were going to take on Sergeant Shriver. So Shriver took the ball and was the key factor in getting it moving. He had a lot of influence in the White House, as you know, and once he made up his mind that this was something he wanted to do, he got us a pile of money to the Bureau of the Budget in those days and Congress to get it going. Sarge doesn't get as much credit as, his name is seldom mentioned in terms of the health center program, in my knowledge, and he should. I mean, it wouldn't have happened. It would have happened, I think, later in the public health service. As a public health service bureaucrat, I believe it would have bubbled up in the public health service eventually, as it did. So it would have happened, but it wouldn't have happened quite as soon and quite as dynamically without Sarge.